Okay, we are with test and measures number 2, and we are going to look at passive accessory testing for the TMJ. Okay, so this is going to bring back a little bit of review of biomechanics from the initial lecture that we did. Okay, so the first passive accessory test we're going to do is for a caudal distraction. Okay, a caudal distraction of the TMJ. So if I'm his left TMJ and I am the articular eminence, the temporal fossa. Okay, the articular eminence is actually the part in the front, and I am the head of the condyle. A caudal or inferior distraction is going to be one in which I apply a force inferiorly to distract or separate the two joint surfaces. Okay, so I am going to have my patient slightly open his mouth. I'm also going to make sure that he remembers our safe signal. That means get out. Okay, for many reasons. Anyway, so I'm going to use the sorry, there's a cat and dog fight going on in case you can't hear that in the background, but they have left the room.
Temporary.
I'm going to put the pad of my thumb on the top of his back molar. So come over here, look. Okay, so my thumb is going to go on the top of his back molar. My index finger is just going to rest along his cheek. My fingers, these fingers are going to be wrapped around his mandible. Just make sure with all of this that you're not compressing a carotid artery or pressing into your patient's throat, because then they will not be happy. With this accessory test, as always, we want to make sure that our line of force when we can is in line with our forearm, okay, or that our forearm is in line with the force, okay. I'm going to stabilize here on his forehead. My line of force is going to be inferiorly this way, okay, except the pad of my thumb is going to be on his back molar. So once you're in there, you make sure their jaw is relaxed, okay? And then I'm going to apply an inferior force, take up the slack in the capsule, and when I get to what I feel like is the end range, I'm just going to do a little spring, okay? Just to get a sense of what that end feels like, okay? I'm going to give my patient a break. So that was a caudal distraction of the head of the mandible, or the condyle of the mandible, from the temporal fossa, a distraction. The next one we're going to do is going to be an anterior glide, okay? Because that anterior glide is something that needs to happen with opening of the mouth, okay? So remember that with mandibular opening, there is a posterior roll and an anterior glide, okay? That is what happens. A posterior roll, anterior glide. Okay, so here we're going to work on that anterior glide. Same hand setup, except now to do an anterior glide, remember it's anterior with respect to his body. So my forearm is now going to have to be in this direction. Okay, so that my forearm is in line with the line of force. Same setup, same hand hold. This hand stabilizes his forehead. Okay, he relaxes his jaw. If he's clenching and holding, I'm not going to be able to move him. So he's nice and relaxed. Okay, and then I'm going to pull anteriorly. Take up the slack in the capsule, give a little spring at that end range just to get a feeling of, is it a springy end feel or is it a hard or a firm end feel? Because if it's capsular, it should have a little bit of give to it. That is what I call a springy end feel. The next one is going to be what I call a J mobilization. Okay, so it's going to be a combination of a caudal distraction and then an anterior translation. And I'm also assisting with that posterior roll that needs to happen in the joint. Okay, so remember, I'm his left TMJ. I need to be able to roll posteriorly and slide or glide anteriorly. So I can replicate that functional movement of opening by I'm in the same hand position. I'm in the same position that I just was for that anterior glide, except now I'm going to apply a little bit of a caudal distraction, and then I'm going to ulnarly deviate my wrist. Okay, it's going to mimic what happens with opening, okay? So I'm back in here, my setup is the same, okay? I'm gonna apply a little bit of a distraction, and now my force, I don't know if you can, I can't really exaggerate it with my wrist, but hopefully you can see my wrist right there going into some ulnar deviation, okay? That replicates the motion of that needs to occur with opening. Okay, now what I didn't say before, if I go back to that anterior glide when I pulled this way, I could also do a posterior glide. I do like to give a little bit of a distraction first with these. So before I do the anterior glide, I get a little bit of a distraction. But in addition to doing an anterior glide, I could also do a posterior glide, which with respect to him would be down towards the table. And again, I'm taking up the slack of the capsule. I'm getting to that barrier, give a little spring to assess what that end feel feels like. So I'm feeling the motion, you know, between those two articular surfaces, and then I'm testing to see what the end feel of that capsule feels like. Is it a hard end feel, or is it a springy end feel? Because typically I am mobilizing hard end feels. Okay? Okay, now I'm gonna have Ethan, I want you to lie on your side.
Okay, it's the other side?
You're gonna stay here for just a minute. I'm gonna put this pillow, I don't have a pillow, but it is a rolled up towel. Okay, I am going to take off my glove because now I'm gonna be external. So yes, you can you see me from here? Yeah?
Yeah, it's your hand.
Okay. Now, externally, okay, remember if I come just anterior to the tragus of his ear, I should be at the posterior aspect of the TMJ, okay? Or the posterior aspect of the head of the mandible. So if I'm not sure, I could have him open a couple times. So open your mouth, please. Here we go. And actually feel it move forward, and then it comes back at me. Do it again. Good. And bring back. So now what I'm gonna do is I'm gonna take the side of my thumb. I'm gonna do an anterior glide of this head of the mandible, okay? From this position. So Luke, if you can move back that way so they can see my body position. You move back away, just be nice and slow. Okay, I want my forearms to be in line with my direction of movement. Okay, so hopefully you guys can you see that clearly, Luke?
Yeah, just not his head.
Okay, so now you can come back. I just wanted them to see that. Now you can come back. Actually, why don't you come around the table so they can see you in the front. Thank you for making that nice and smooth.
It's not smooth.
It's better than Julian was doing. They may have gotten motion sickness from Julian's videos. I have a different videographer today, guys. Okay, so if I want to impart an anterior glide, okay, or that anterior, an anterior glide to the head of the mandible, I'm going to use one thumb. It's my dummy thumb. The one behind it, it's going to actually apply the motion, okay? I'm going to get down into the plane of the motion that I want to do, and I'm going to glide that head of the mandible anteriorly, feeling for the amount of motion and giving a little spring at end range. Okay? Stay there. Move back this way. Now, if I want to look at posterior translation, I'm going to feel the anterior aspect of the head of the mandible. Okay? I'm going to be on the anterior aspect of it. If I'm not sure, I can have them open. So open. Yep, I feel it moving forward into my thumb. I'm going to be on the front of it here, moving in a posterior direction. Okay, this one's a little harder to feel. Remember these are light, gentle pressures. I've got my dummy thumb, and then my mobilizing thumb. My force direction is that way. It is a posterior glide of the head of the mandible. Get a sense for the amount of motion, and then at the end range, nice little spring. Okay. And that is it for passive accessory. You can turn it off.